The guidelines, seem to use newer research in the last few years. So where do the guidelines fall in terms of treatment below the knee and into the foot? Now, even this summer, I had a surgeon tell me that according to 2013 data, treating below the knee was an absolute quote, and I quote, waste of time because it only leads to a revolving door of treatment. So why delay the inevitable, unquote. What guidance should patients be aware of when they have blockages in the tibials and the pedal loop, which is prevalent in patients who have diabetes and chronic kidney disease, two of the highest risk factors for PAD, and especially CLI?
So the guideline is very, very, very clear about this. Very clear. There is no ambiguity. If you have claudication, there is no indication to treat below the knee, period. If you have claudication, that is because claudication is an inflow problem. So usually the problem is in the iliacs or in the SFA, in the femoral and popliteal area. So you don't need to go and do the pedal loop for claudication. That's not going to do anything, right? So that's very clear. When you're talking about CLI, when you're talking about in patients with ulcers and gangrene, patients that need minor amputation, patients that are at risk of losing their leg, the guidelines give a class 1 recommendation on multiple different ways. Not only they give a class 1 recommendation to treat below the knee, but they say that you need to have an inline flow to the wound. So they approach this in a different ways, and they give a class 1 recommendation in all of these that you need to bring blood to the wound to be able to heal the wound. And there's no way you can do that if you don't treat below the knee. So if you just treat the SFA and the iliacs and you don't treat the outflow, you won't be able to get enough blood flow to the wound to be able to heal it. And that's where patients get into trouble with their ulcers and end up with amputation. So you're absolutely correct. And that, the guidelines have made it very clear now that, below the knee intervention for CLI is a class 1 indication, and that we should try to bring an inline flow to the wound as much as we can.